Hello from Los Angeles. I'm Emily Farkas, Senior Editor for CTSNet, and we are here at STS 2025. I'm joined by Dr. Marcelo Cardarelli, who's a volunteer global cardiac surgeon with the Global Cardiac Alliance, and also the interim chief of pediatric cardiac surgery at the Johns Hopkins Center for Children in Baltimore. Thank you for joining us.
Thank you for the invitation.
So you have a great talk coming up that's going to look at the cost of cardiac surgery worldwide.
Right.
If you were to pick out 2 or 3 primary summary points, what would you say were the most important?
Well, the most important points to convey is that, number one, we're very good at what we do. All of us know how to do handiwork, how to assess risk, how to take care of patients. And we are terrible about understanding the financials of healthcare. So my talk is about waking up that and the surgeons that are going to be attending and trying to understand actually what the real cost of cardiac surgery are, the difference between cost and price, and why cost is so different around the world. Because you read that in the media, and what is that supposed to mean, right? So trying to make sense of all that in 8 minutes, and hopefully when everybody walks out of here, they're going to think about this.
Okay, well, I don't know the difference between cost and price, so illuminate me.
So cost is, what actually things cost to be done.
Okay.
So we know that you need many things to do heart surgery. You need capital cost, which is expensive. You need a hospital, you need all those things. And then you need all the disposables, which are used once and thrown away. And then you need the labor. You have to pay people to do the job. And then you have all the indirect costs, which are energy, electricity, gas, all those things. When you put it all together, in theory, if there were no tariffs and there was no cost of transportation, in theory, everything should be the same price around the world, but it's not. Okay. And there's a reason for that, and it's the purchasing power parity of the local currency. It's not the same to buy, and I'm going to show an example, it's not the same to buy the same product here in America, in Europe, or in Asia. For instance, the difference in price for a latte at Starbucks is as low as $1.7 and as high as $7. So it's not different than what happens with cardiac surgery around the world. And yes, we are expensive. There are other countries that are surprisingly expensive, and there are others which are very, very inexpensive. Their currency is undervalued or devalued, and that's why it's so seemingly cheap.
So are you saying that the industry doesn't change what they're asking for an item, but it's reflective of the local economy and the value of their...
It's mostly reflective of the local economy. And actually, we have done surveys with the Global Cardiac Alliance about the cost of tetralogy of valve repair, but applies to all the... We took tetralogy because it's the most distinctive of all the pediatrics, done, perform about a year and a half of age, because neonatal is a different animal altogether. 1 year of age, the difference goes from $5,000 to over $60,000. And all depends on which countries. And when you trace it, the income per capita tells you how much the cost of something is going to be. And that applies to heart surgery, coffee, Big Mac, or anything that we can sell.
So how do we tackle this then, if it's a bigger issue, a global issue?
We tackle this in many ways, but number one is to understand it, right? If we don't understand the problem, we can't fix it. Number two is to start by understanding it, to start talking about realistic interventions that can improve that. The reason there is no cardiac surgery in sub-Saharan Africa is not only poverty. There are other reasons. And, that applies to everything. So we need to be, we're smart, we care about our patients. We need to understand the financials of heart surgery in order to advocate for them. For instance, 3 years ago, we did a paper that's published, free of charge in JAMA Open, and it's about cost effectiveness of pediatric heart surgery. And if I told you that pediatric heart surgery, which seems to be extremely expensive, has the same cost effectiveness than giving away condoms in Africa to prevent HIV. Absolutely same number, $171 per year of life, improved. So that's very shocking. When you show that to governments, they start thinking that maybe we should start helping and subsidizing heart surgery for children, which are the future.
That is interesting because there is a lot of talk about philanthropic economy, and people will argue that mosquito nets are a better value than
The mosquito net is the same as cardiac surgery, is the same as condom. So it's tricky because you think about how sophisticated is what we do. The prices tell a different story.
Well, those are some compelling thoughts. Have you seen arrangements in certain countries where they try to barter certain things? For instance, a company will give a heart-lung machine if they buy 60 valves, or have you seen arrangements like this? How does that affect this whole picture?
Yeah, we see that, and it's the same as many things that happen here in America. They give you the product away as long as you use all the disposables from the same company. It helps if the price is low. I will show on Sunday a slide about, maybe we can put a link on our conversation, a slide, because the thinking is, well, the countries who manufacture oxygenators very likely have less cost of doing surgery because the oxygenators are made in the country, right? Sure. Well, not so clear, and the prices are all over within those countries. So it's one measure cannot change anything. It's a right combination, but mostly it's governments understanding that as countries go into what is called the epidemiological transition, and people stop dying from infectious diseases and they start dying from chronic diseases, they have to adapt and start spending money on the things that are going to prevent these children from dying. And the same applies for adults doing, CABGs and mitral valve surgery in places with rheumatic fever.
Well, certainly the World Health Organization mandates the same, don't they? So one last question. You said the first key is to understand the problem, and I certainly agree. Is there one piece of advice you would give to surgeons like yourself who are traveling to perform global cardiac surgical efforts? What is it you can do on that level to sort of move the needle here?
So in order to move the needle in those countries, I think it's great for anybody who volunteers to come with us or any of the other 80 organizations doing this. We have to understand two things. Yes, there's a lack of money. But if we had all the money to take care of all the patients that need heart surgery this year, that would be about $2 billion. That's not that much money. That's 1 week of a war in Afghanistan, 2 weeks of a war in Ukraine. So that's the money part. But the other part is human resources. You need 10 years to make a heart surgery. You need 5 years or 7 years to make an anesthesiologist. Those countries are lacking money, but they're lacking human resources. So when you go, training the locals is the most important thing you can do to move the needle.
Couldn't agree more.
Yeah.
Wonderful. Thank you so much for your time. We'll include the links that you talked about, and we're looking forward to your talk.
Thank you.
Great. Thank you.